This company was started 85 years ago in Sweden, and in 1988, Mr. Weissman acquired it. We're located here in New York, the research and headquarters for North and South America. But in Stockholm, Sweden, we distribute our products and do our manufacturing for all over the world. Mr. Weissman is the developer of many different dental devices. He's the inventor of Parapost, and it's an endodontic product, and TMS pins, and has a long list of products that he's developed for dentistry. Small devices. We specialize in things that are very, very small, and we have really beautiful capabilities in our manufacturing facility in Stockholm. Our general manager is there, and he oversees quality control. Sweden has a very high standard that we really are proud of, and we have a beautiful, beautiful production facility over there. So we've been in the dental business for a very, very long time. I personally have been in the industry for over 40 years. In the late 90s, we developed an implant that is used for transitional purposes, or what we call interim. And what do we mean by that? When patients who lost their teeth and would go for full implant treatment, meaning a full arch. It was a very, very long procedure 25 years ago. It involved a lot of intervention, if you will, in terms of treatment planning, and the duration of the procedure was very, very lengthy. Oftentimes, patients would have to have, if they were having a full arch restoration, it wasn't unheard of that patients would have to have a bone ridge augmentation procedure. These things led to a lengthy time frame, meaning 8 months, maybe 12 months, maybe even a year and a half. Today it's a shorter procedure, but back in the early year of 2000, it was a lengthy procedure. So interim implants, ours was called the MTI system, was a method for which patients would get a provisional restoration during this lengthy procedure, so that they would never have to be without teeth. You can imagine that in those days, people who had full arch restorations were people who could afford it. People who could afford it also had very visible lives and professions. And so the idea that you could actually give them a fixed restoration immediately following surgery was a great, great benefit to those patients. And they cost a fraction of the overall procedure cost. Interestingly enough, Sweden was one of the first countries to use titanium, and that's where Dr. Brånemark developed one of the leading companies in implantology, developed his system, because titanium is a very good material for adaptation in the bone. It's very kind to bone. They get together well. So we had titanium post products, and what we discovered after using our implants as a provisional was that they integrated this very same way that the larger diameter implants did. And thus came the idea, the birth of the idea of using narrow diameter implants as an implant just as you would any other. What's interesting about ours, because we started off transitionally, our implants were 1.8, 2.2, 2.4, and they still are. Implants, what we would call conventional implants, were in diameter 3.5 millimeters to 6.5 millimeters. And at the time when we developed ours, the trend was to go bigger and bigger, and we went smaller and smaller. There was a lot of pushback in the early days for our implants. People didn't think that they would be strong enough, that they wouldn't integrate, that they might interfere with the healing process of what we would call the larger diameter implants, but in fact that wasn't true. And in 2004, we had made, by this time, several changes in the implant design with our mind that we would like to be what we call a permanent or a definitive implant. So we had undergone design changes from our transitional to the newer version. In 2004, the FDA granted us permission to market our product as a long-term device, a long-term implant device. And that's who we are today. I would say that today our small implants are very unique, one of a kind, and the only one in the arena of narrow body implants that is screw retained, meaning that we don't use cement. Permanent means that we take replace a missing tooth with an implant and a crown that replaces the missing tooth, permanent for as long as it lasts. We don't know how long they will last. The industry has said that you must provide data that it lasts at least 10 years, and we have that data. Our implants have been in use for that period of time and longer, as has been presented in clinical papers, in the Compendium magazine, in the JOMI magazine, in many different places. We have studies that will speak to this, that 48 implants in one study and 26 in another, where our implants are being used for a long, long period of time and are as effective and have the same survival rates as any other implant.